Excellencies, distinguished guests, dear colleagues and friends, welcome to the virtual side event on ensuring mental health through parenting support during the Commission on Population Development 2025. As a federation, we're committed to enhance the content of key areas of advocacy that we see developing at the world arena. In this regard, mental health is gaining attention on how it impacts family members. We are honored to count with such experts to help us and the international community to enrich the discussion on how to improve the role of parents and their mental health for better population outcomes. These are the almost exact words that I just delivered on behalf of IFFD here at the Commission just a few minutes ago at the UN, when they're all convening for the Commission on Population and Development. And many member states have recognized that it's really a growing issue and something to really tackle on and work on. So I'm happy that we're having this discussion and developing some good policy recommendations coming from evidence. And I'm happy to see friendly faces that I've been in contact with in the past months. And also happy to see you all here. I will start now to give the floor to Mr. Olivier Yao. He is our World President of the International Federation for Family Development for welcoming remarks. Mr. President, you have the floor for welcoming remarks.
Can you hear me?
We can hear you now, Olivier. Please.
Sorry. I'm so delighted to be part of this big event that we are organizing with all of you for this mental health initiatives. As rightly mentioned by Alex, it is part of the key issues that each family should be striving to make sure that it is addressed, because all of us, we are subject to this situation. We can see it all over the world. Many causes are part of the trigger, and it is key that each one of us play the biggest role to make sure that they don't suffer from it. We have many big situations that are preventing us to live in peace. Mental health shouldn't be part of it after this forum. Our dear speakers are there to make sure that we understand, all of us, what is in mental health that each one of us should be doing. And please, do not hesitate to ask any questions. Do not hesitate to contribute. And I will leave the floor to all our dear speakers to make sure that after this session, we are all prepared for mental health fight. Thank you very much, Alex.
Thank you so much, Olivier. And Olivier is actually connecting from Ivory Coast. He's our world president for some years already. And we're really happy to have him and all his insights from the private sector all through the parenting courses. Thank you, Olivier. And thank you for your support. And well, as you know, this event is an early attempt to enrich the discussion on mental health and how it can improve the life of many families and its members. That is why we will go through various angles and stakeholders to begin shaping the implications of parenting support and their mental health. We will start by exploring why the early moments matter for parents and their children. So allow me to turn to our first panelist, Dr. Erika Komisar, founder and president of Komisar Training Consultants. Dr. Komisar, you have the floor.
Thank you very much, and welcome everyone. So I'm here to talk about 0 to 3 and how that impacts mental health in the future. What we know from all of the research is that attachment security is critical to the future mental health of children. That by the age of 12 months, if a child does not have attachment security, 80% of those children 20 years later will not be securely attached. And that insecure attachment, or what we call attachment disorders, are correlated with different forms of mental illness, including anxiety, depression, personality disorders. And so then the question is, of course, where does it come from? How do we help to make sure that children have attachment security in the first 3 years? And what we know is that 0 to 3 is what we call a critical period of right brain development, where a primary attachment figure, who's usually the mother, her physical and emotional presence are critical to the formation of that attachment security. That infants are not born resilient. They are born neurologically, physically, and emotionally fragile. And in most parts of the world are worn on their mother's bodies for the first 12 months and then kept close at their heels for another 2 years in order to ensure that at that 3-year point, that child has internalized a feeling of safety and security, the ability to regulate their emotions, and to cope with future adversity and stress. All of the research points to the fact that the way that we are encouraging women to leave their children so early to return to the workforce, the lack of financial support from governments, the lack of social and emotional support from family members, friends, and employers is contributing to this mental health crisis in children and adolescents. So if we want our children to be mentally healthy in the future, we have to admire mothering again. We have to prioritize it. That doesn't mean we can't empower women over their lifetime to be producers and earn money and be in the workforce. But in those early years, when children critically need the physical and emotional presence of their primary attachment figure, who is the center of their universe and who gives them a feeling of safety and security in a very insecure world, then we are not doing what's right by children. We cannot talk about the mental health crisis in children and adolescents without talking about the way we raise children and its early beginnings. Alex, should I continue, or I sort of took my 5 minutes? I wasn't sure if I was allowed.
Yeah, perfect. No, it's perfect.
Okay.
I thought there was a connection issue, but thank you so much for keeping the time. And we'll definitely go back to you with questions from the audience, or even questions from myself that I've been seeing here around the UN. So thank you so much for this. And it's true. I mean, we've seen it with not only with recommendations from UNICEF, but now lately here, that those early moments are the most important. So thank you so much, Erika. Now we will focus on mothers. I mean, we've been focusing on actually parents, but now we'll turn to mothers as the first and most important caregivers as we grow and develop. Ms. Yusra Qadir is Chief Programs and Advocacy Officer at Mothers Matter Canada, and she has an extensive experience on program design and management to empower vulnerable and marginalized communities, especially women, children, youth, refugees, and forcibly displaced communities. So I'll give the floor to Ms. Qadir.
Thanks so much, Alex. Good day, everyone. I'm joining you today from the traditional, ancestral, and unceded territories of the Tsleil-Waututh, Squamish, and the Musqueam nations, a place we call Vancouver. Thanks, Alex and IFFD, for having me. I work with a nonprofit organization called Mothers Matter Canada. It's a national Canadian organization that supports mothers to break the cycle of poverty and isolation and reach their fullest potential. Using a mother-to-mother approach, our partners serve over 1,700 mothers and families that come from over 60 countries across Canada each year. So I will bring a practitioner's perspective of working with mothers and what we can do to enable better mental health outcomes at the mother's level. I'll share with you some context from Canada and leave you with some things that we as individuals and organizations can do. So I want to throw some numbers in the mix over here. So over 23% of Canada's population is immigrant. This number is increasing. 1 in 5 Canadians experience mental health issues each year, with women being more likely to be affected. And immigrant women in Canada are 3 times more likely to experience mental health distress than Canadian-born women. So holistically, we know the WHO in 2016 found that every dollar invested in mental health yields $4 in improved health and productivity. Yet millions of women worldwide and many women in Canada are not able to access mental health supports. So this shows us our first need, the right policy environments where investing in mental health is recognized as investing in significant economic and social capital returns. I'm quite proud of the parental supports we have available in Canada, and it's even better in Quebec. So we have a 15-week maternity leave, a 40 to 69-week standard or extended parental leave, and financial support like employment insurance and our income-tested child benefit. So policy environment-wise, in contrast to some other parts of the world, we've been working this puzzle well. The piece we grapple with is equity. Not all families can benefit from parenting and financial supports due to ineligibility. They don't meet the requirements, language, financial, and accessibility barriers, cultural relevance, and the stigma associated with mental health. In the communities we work with, there's a very real fear of children being taken away by social services if mothers and families opened up about their mental health issues and concerns. So for us, the central piece is equity. I want to leave everybody with 5 things that we can do as individuals and organizations. So 1, recognize the issues and own them. For all of us here, the issues may look different, but there's a critical piece around really assessing how, why, and to what extent are our systems failing parents, especially mothers. And without this piece, we cannot move forward. We cannot build responsive programs. We cannot advocate for better policies. I cannot overemphasize the importance of a good evidence-based to support programs. 2, stop glorifying inequitable distribution of unpaid care work. When we call mothers superwomen, supermoms, we are celebrating women's fatigue and burnout and encouraging them to wear exhaustion as a badge of honor. So we desperately, desperately need healthier and more realistic narratives around mothering. 3, find culturally appropriate ways to redistribute care work at the household and community level. We need to move away from the colonial approaches where we tell people what shared responsibilities should look like in their home or community. Our job is to engage families holistically and help them find ways that work for them and accept that it's okay. They will look different from household to household and community to community. 4, normalize bringing our whole selves to work. How many times have we heard mothers saying, I'm sorry, my child is sick, I want to take a day off today, or I'm sorry, I need to take my child to a doctor's appointment. We cannot be asked to apologize for supporting our children, raising our families. I cannot park the mother me outside the door when I enter my workplace. And if I'm forced to do that, the mental health impacts are surely negative. The American Psychiatric Association found that employees with unresolved depression experience a 35% reduction in poverty. So we are accepted as our whole selves at work. We have better mental health and our workplaces ultimately benefit. 5th, we really need to lean into technology and the opportunities it offers. Depression and anxiety cost the global economy an estimated $1 trillion per year in lost productivity. So if we can create flexible work arrangements, centering mothers and parents by using technology, we can invest in mental health, empower parents, especially mothers, strengthen families, and contribute to economic growth all at the same time. So for me, the call to action here is clear. We need to build societies that are inclusive, resilient, and equitable. That means we need to continue advocating boldly for ensuring that mental health supports and resources are integrated across the broader policy frameworks. They're weaved in through the world of work, and they're included in parental support programs. We have to ensure that services are culturally competent and policies are equitable. Literally, the health of our families and the future of our societies depend on it. Thank you.
Thank you so much, Yusra. And definitely, I love the mention of equity that you said, because we just had an event here yesterday at the UN when they were mentioning not only how to build on care for children, but also how to make it more accessible and also consistent over time, because it's definitely something that families are expecting to have, not only when the baby is born, but definitely later on. So now let me turn to the healthcare perspective. That definitely mental health services and family support should not be separated silos, as actually Yusra had introduced, but rather they're in the interdependent systems that must work in concert to protect children and caregivers alike. So we have invited one of our experts who has been designing some of the IFFD courses on mental health, especially anxiety. Dr. Mariana Azcárraga from Mexico, a psychiatrist at the Medica Health Center. And she has an experience advocating health systems reform and has been working on how health services can better meet the needs of families. Dr. Azcárraga, you have the word.
Thank you. Good afternoon. Can I share a presentation? It's very short. Can you see my slides? Great.
Yes.
I think some of the points I'm going to share have been shared before, so I won't repeat. So, well, good afternoon. As you said before, my name is Mariana Azcárraga. I'm a psychiatrist based in Mexico City, and I work with caregivers in clinical and academic settings. I want to highlight today the importance of supporting caregivers' mental health as a key strategy for promoting resilience and well-being in children. Sorry. So caregivers' mental health has a profound influence on children's development and emotional well-being. First, research shows a direct transmission of mental health symptoms. Children are more likely to experience anxiety, depression, or behavioral problems if their caregiver is struggling with mental health challenges. Second, the quality of the caregiver-child relationship is essential. The positive supportive interactions promote secure attachment, brain development, and emotional regulation in children. In contrast, high stress or emotional unavailability can lead to long-term negative outcomes. Also, the caregivers are the children's primary role models for coping. Mentally resilient caregivers are better able to model healthy emotional responses and coping strategies with children, which children tend to adopt and internalize. So, well, we will see what we can do to support the caregivers. Several key factors have a strong impact on caregivers' mental health. Caregiver burden is often significant, especially for those looking after children with chronic condition or special needs. This burden tends to grow during crisis. For example, like with the COVID-19 pandemic, we saw that a lot. And this is closely tied to anxiety, depression, and emotional fatigue. Also, social support makes a big difference. Caregivers with a strong emotional and practical support system handle stress better, while those who feel isolated are at higher risk of burnout and mental health problems. As well, socioeconomic stress plays a major role. Financial strain, housing instability, or limited access to services can lead to chronic stress, affecting the well-being of both the caregiver and the child. So we have to recognize and address the challenges to build strong and healthier families and preventing long-term negative outcomes. So what we can do to support caregivers' mental health? Well, to do this, we require a multi-layer approach. These 6 strategies can have a meaningful impact. First, psychoeducation and parenting programs help caregivers understand mental health, manage stress, and use positive discipline. These tools not only improve the emotional regulation, but also help them feel more confident in their parenting. Second, social support is essential. Being part of a peer group or a community network can ease the sense of isolation and offer emotional relief. Third, access to therapy, whether individual or group, gives caregiver a space to process their stress. Models that support both the caregiver and the child tend to work especially well. Fourth, we should provide practical support. Respite care gives caregivers time to rest, and financial aid or paid leave, as someone said before, help reduce daily pressures. Fifth, we need policy level support. Things like paid family leave and affordable childcare give caregiver the stability they need to take care of both their children and themselves. And finally, early intervention is essential. When support is offered early, especially for those caring for children with complex needs, it can prevent a lot of long-term emotional distress for these parents. So in short, when we give support caregivers in these ways, we help build stronger and more resilient families, and they benefit everyone. So thank you.
Thank you so much, Mariana. And definitely when we see some of the wording on parenting support or parenting education, family-friendly policies, we definitely consider that access to healthcare and health providers, as you have related, it's comprehensive of not only recognizing the stages of life, but also the situations that they can experience. And you know exactly how our courses go through, like first letters, first conversations, early steps. So it's great to have that whole view of the development of children and families. And because of that, I want to now turn into another dimension of development of us, that is education. So either if you stay at home taking care of your children or send them out to be taken care of, like quality early childhood development or even kinship care, schools are often the first point of contact where challenges in family mental health become visible, either because we see that or they tell us, and especially through children's behavior, learning patterns, and emotional regulation. So I would like to introduce to Professor Kyong-Ah Kwon. She is a professor and Drusa B. Endowed Chair at the University of Oklahoma, and she brings the educator's perspective with the Happy Teacher Project. Professor, you have the floor.
Thank you very much. Can you hear me? Okay, I have PowerPoint ready. So there you go. Okay, hi everybody. Good morning, good afternoon, good evening, everybody from the globe. I'm honored to be here to share some insight from the Happy Teacher Project, why we need to invest in the well-being of early childhood teachers to support children and families better. So high quality childcare matters not only for children and families, but for all of us. It is a public good, a workforce necessity, and then the foundation of our collective future. And specifically why it is so important. I want to say, like today, 15 million children under age of 6 in the United States is about 66% of all children have all parents in the workforce. This means that roughly 11 million children in the United States are in non-parental care, and many spend 3, 5, and 8, and even 10 hours in care every day. And the quality of those hours heavily depends on one thing, above all, the teachers. The research is pretty clear, as many of you mentioned already. The first 5 years are most critical for development of brain development and the social emotional growth and foundation of learning. And then early childhood teachers play a really, really important role in shaping the developing brain and then building consistency and security. They also serve as a trusted guide and partners for families, often reducing the parenting stress and strengthening connection between school and home. And then it is also key to our economy. The childcare disruption costs state between $500 million to $3.7 billion every year. And yet, these vital educators face immense challenges. There are about 2.2 million early childhood educators in the United States. 95 of them are females, and many of them are mothers themselves, carrying the dual burden of caregiving at home and at work, often without adequate support. So, for example, according to the report from Georgetown University, out of 137 college-educated employees, educators across all the sector rank near the bottom in average income. In particular, early childhood educators with a bachelor's degree rank last at 138th, 7th out of 137. Then our recent data also shows that most of the teachers working in childcare setting are minimum wage or live in poverty. We cannot expect high quality care when we pay them the least. It's not just unjust, it's unsustainable. And financial stress fuels burnout and turnover, which destabilizes the relationship children rely on for security. This strain is especially high among teachers working with families facing poverty and trauma like Head Start in the United States. Look at this Head Start national data. As you see here on your left side, about 43% of Head Start mothers experience mild to severe depressive symptom, with 22% meeting clinical thresholds. As you all know, and this some of you already mentioned, the maternal depression is one of the most significant factors for children's development. And then it is pretty well known that mothers living in poverty are more likely to experience a high level of depressive symptom than their middle-class counterpart. But what's more striking here is on your left-hand side that the rate of depressive symptom among Head Start teachers that mirror that of mothers. So how can educators buffer children from stress and trauma if they themselves are not well? Imagine this many children have depressed mom at home and depressed teacher at school. And think about the potential negative impact of those double jeopardy and breaking down the safety net these vulnerable children need the most. And this number even seemed to underestimate the actual prevalence. Our most recent post-COVID research shows that 32% of early childhood teachers meet the clinical criteria for depression, joining many other studies. And it doesn't stop there. Early childhood teachers report high rate of ergonomic pain, obesity, below average cardiorespiratory fitness, urinary tract infection, and asthma at levels higher than the general female population. As you know, this is important because the physical health is deeply intertwined with the mental health issues. So what do teachers need? Definitely livable wages and benefit, a daily and paid break, and then more support for behavioral needs of children, and more support and resources for their own well-being, and then needs more supportive physical and psychological environment, and more coaching and professional development support. And these are not luxuries. They are foundation of high quality and of stable relations and of developmental protection for young children. Now, let me end with this last cohort. It basically says when teachers feel whole, children and families thrive. We cannot really separate the well-being of early childhood teachers from child and family outcomes. It's a time to invest not just in curriculum or assessment, but in the humans who make learning and healing possible every day for children and their families. Thank you.
Thank you so much, Professor. And it's definitely something that you remember when you grow up as a happy teacher that engaged with you and really had an impact on your life. So thank you so much for bringing that up. And now to broaden our scope even further, we now turn to the built environment that we have around us, most of us at least, because urban design and planning decisions can significantly shape family life, mental health, and caregiving capacity. I'm telling you here from New York, so definitely that's something that impacts us all as a family. And from access to green spaces and safe public transportation to proximity to health and community services. That's why we've been working with some mayors and governors. Well, I guess we're at 250 already. And they've been developing some good practices for family-friendly cities or urban settings. So the person who has been helping us with that project is Ms. Francisca Tettevie, Lawson. She is an emerging family science expert at the University of Nebraska-Lincoln. She is passionate about designing cities that prioritize the well-being of caregivers and their children. She is also part of the working group to prepare the Second World Summit on Social Development, that together with various young academics from 18 countries, they're preparing some inputs for that big event that is coming for the UN and is going to definitely impact the whole world. So Francisca, the floor is yours.
Thank you, Alex. I would share my slide.
Mhm.
Yes, give me a second. Yeah. Yes. Yeah. Thank you, everyone. I'm so privileged to be on the panel and share insights from the project, the Inclusive Cities for Sustainable Families project with IFD. I'm currently a PhD student at University of Nebraska, but I'm interested in interventions that support families and promote well-being, and specifically around health. And one aspect that I'm passionate about is the environment. So for this presentation, I'll highlight we've talked a lot about parenting and support, mental health and all that. I wanted to highlight the piece of what city and urban planners can do. How can institutions in our environment or in our communities, what's their role in all of this discussion? Yes, I'll just give a brief overview. I know most of the panelists have already highlighted it. So I wanted to highlight that parent-child relationship is one of the most influential relationships in a child's development. And also, as Dr. Kwon also shared about early childhood educators as well, and also other health professionals, those key relationships are also influential in children's social, emotional, cognitive, and also even their health outcomes as well. And there are some key child development theories like Bronfenbrenner and Bowlby that also highlight how systems or the communities that children grow up in and the relationships that are surrounding them also play a key role in their development and their well-being. And there's also other health models that also emphasize the need to develop a comprehensive understanding when it comes to looking at health outcomes for children and individuals and families at large. And for parental mental health, one of the panelists also highlighted that we've seen that there's poor health outcomes for children that have caregivers that have struggled with their mental health or mental well-being. And defining mental health broadly, WHO also highlight that mental health is a state of well-being where individuals are able to realize their own potential and they're able to cope with stresses, they are able to work productively, fruitfully, and they're able to make contributions to their community. So also looking at the structural determinants of health model, it looks at the conditions surrounding like families and parents or individuals and how they affect their well-being, their mental health, like how they are able to cope with stresses, how they are able to work, and how they are able to care for their children and all that. So there are different factors or there are different determinants surrounding us that tend to play that key role. And looking at, so going back to that, so for this, I want to highlight how some key cities as part of the projects are making improvement, making changes into promoting the mental health of parents or families at large. And in the sense that they are addressing some of these barriers that these systems tend to create in the society. So some of them will be looking at using technology to produce telecare services for families, for mothers, for like communities that mothers or parents live in. Some are also interested in building green spaces, making sure they have access to transportation services. There's also like exercise built in, like biking, cycling. Some people have like fitness built in how they structure their cities as well. There's also people, cities bringing jobs and giving like promoting like giving income and supporting parents as well. And there's also quality in education, creating early childhood care spaces where there's like great access for low income families to be able to have access to these things. And so in terms of like one of the projects is from Brazil, the program is interested in providing income transfer to vulnerable families. So imagine a parent is struggling to keep up with rent, to keep up with education fees and all that. So having that income transfer also takes some part of that caregiver burden that parents have. And there's also another project on streets clinic in Brazil and providing, so some families might be living like not having access to healthcare services. So they have the streets telehealth care service that provide that support for them that they can always use. There's also the Strong Families program, and they provide parenting programs and on social emotional skill development and all that. That also helps the parenting stress that comes with raising young children as well. And there's also a youth center that is also promoting, like having programs where promoting skills training, doing community gardens, and all those projects helps to give people the skills to be able to work, to make a living, and also transform the city, pave streets, and there's like proper sanitation and also public services available as well. And another thing too, it has to do with like nutrition. Sometimes parenting the stresses, the financial burden, maybe not be able to provide nutrition for young children. So take the Mexico schools nutrition also helps take that burden by providing nutrition where students have access to lunch or like fruits and meals, balanced meals for children as well. And so for other school interventions can also look at behavior management and programs or keeping children busy in school to learn a skill or engage in fun activities or leisure or physical activities that help them to also take that burden of parents. And yeah, so to summarize all these things, I would say urban planners or cities can focus on developing interventions that address different systems that affect parents. So looking at socioeconomic security, education, healthcare access, housing, and also like building the neighborhoods. Like how can we have social events where parents can interact with other parents or other families, and just building that sense of community and belonging among them would help alleviate some of the stresses parents have. We'll also provide a support support system that parents can rely on, because we believe that raising children takes a village. And also, we'll also build long-term resilience for the families and communities that they will continue to thrive. And meaningful mental health interventions for parents must also be a collaboration among sectors. So education, economics, healthcare coming together and helps to address the root causes of vulnerability and also inequalities that exist, or the barriers, help address close some of the barriers. And yeah, so I will also say the good practices by IFD also offer both inspiration and a roadmap for policymakers, urban planners, and health professionals to consider, looking at different systems and looking at how those things are impacting parents. So the journey towards comprehensive urban health support for parents is ongoing, and it's not just a one-step thing, and it requires continuous innovation, collaboration, and a deep commitment for us to understand and address the complex social determinants of health that shape the well-being of children in society. So thank you, and that should be.
Thank you so much, Francisca, and definitely something that we have to address in the cities and everywhere is the root causes. So I would like to thank you all the speakers for today. I have some questions already from the chat and also some guiding questions, and I want to recognize the attendance today and definitely great interest of many colleagues here among delegations at the UN, from Malaysia, from Hungary, I see even from Russia. So thank you, and definitely I'll be also the one conveying these things at the UN and also meeting up and following up on these issues later. So I would like to, since I think Erica has to leave soon, I would like to ask Lynn Walsh from UPF to ask the question away. Lynn, please.
Oh, thank you. Alex, sorry, this is excellent. Yeah, Erica, I know it's, I mean, you have a lot of data about the importance for babies to be cared for by the mother in the first few years, but what are the benefits to women in caring for their babies in the first 3 years?
Well, I mean, what we know is that when your children are not happy and healthy, you as a mother can't be happy and healthy. We're only as happy as our least healthy child. And what we're seeing is an increase in attachment disorders in children who are being put into daycare at an early age. And it's not school under the age of 3. It's institutional care. So let's call a spade a spade. And what we're seeing is an increase in behavioral problems, in early signs of aggression, in anxiety, in attentional issues, all signs of fight or flight, because we are separating mothers from babies too early. And so what we know is those children are breaking down. What we also know is that postpartum depression is very, very high right now, and increasing. There's more postpartum depression. The statistics are through the roof. Now, what does that mean in terms of mother-infant interaction? We know that when mothers feel a pressure, a conflict, an internal conflict to return into the workforce quickly, and can't turn to their maternal preoccupation, which is instinctual, can't be with their babies for financial reasons or for pressures from the outside as well as the inside, that it can contribute to postpartum depression. And we have very high rates of postpartum depression. So we're not advocating for a fascist state where women have to stay home with their children. What we're advocating for internationally is that mothers and fathers have the choice, financially, emotionally, in terms of psychosocial support from our societies, from our governments, from our families, that we have the admiration and support to make choices that are right for individual families. Meaning, many women in America, 60% of women, if they were given the choice to stay home in the first year or up to the first 3 years, primarily as the primary attachment figure, would make that choice. but don't have that choice. In the UK, it's 66% of women would make that choice. So we are not giving families the proper choice. When you take choice away from mothers, they are very unhappy and sometimes depressed because you're forcing them to make a choice that goes against their instincts and goes against their maternal preoccupation, evolutionary instincts, which have kept us alive for thousands of years. We are telling women to ignore them. We are dismissing women when they say, I want to be home with my baby. And we're telling them that the value of them is to be in society making money. And that is wrong. I hope
Thank
that
you,
answers
Erica.
the question, Lynn.
Thank you, Erica. And I guess for a nice transition into the questions and some statements that we have lined up, I would like to ask you all those who want and wish to show your camera so we can take a good picture of the event since it's online. And so we'll be definitely quick. Thank you so much. I think just smile, I guess. I see some definitely friendly faces. So, well, with this, we can definitely continue with the first. I think the first question that I had already prepared was from Rebecca Harper. She's joining us from the private sector, actually, TD Bank. I'm sorry, Scotiabank. I know that she's from Canada, and definitely TD is also from Canada, so that got mixed up. So, Rebecca, please, you have the floor.
Hi, thank you. So I also work with family civility, family diversity, equity, and inclusion, as well as I'm the co-chair of the Family ERG, which we work very heavily on parental leave coaching. Scotiabank has done amazing strides when it comes to mental health, as well as family support. And I could go on and on about that. I think everyone on the panel has done amazing work. Where my question comes in are twofold. The amazing work is being done in different countries and in silos. How do we bring it all together? Because the family has multiple social problems and different levels of mental health. And when we speak about family dynamics, especially, we have healthy family dynamics and we have unhealthy family dynamics. Also, when it comes to mental health, as you said, which I loved your presentation, Erica, the attachment disorders. How do we heal the attachment disorders from generations before? So the parents already have attachment disorders and their grandparents. How do we heal that first so that we can now prevent? So it's almost like we have to prevent as well as heal and have how do we do both sides at the same time? And how do we work on level 1 and 2 mental health issues with families and parents and caregivers, and recognize single primary caregivers, caregivers with disabilities and have children with disabilities, chosen families. We talk a lot about mothers, which is fantastic, but we actually have a situation where we have surrogate mothers that hand over the children at a certain stage. So where is that family diversity consideration coming in? And how do we tackle, for example, in Canada, we have social service workers. Can we now train them in this work where they can actually do supportive counseling for those level 1 and 2 attachment disorders, so that we can leave the professionals with the more deeper generational trauma and attachment disorders? So I know it's a multi-level question, but considering that family diversity especially.
Can I, Alex,
Thank
because
you.
I have to go, can I just respond and then I'll
Yes,
leave
please,
other
and then
people to
we'll
respond?
open
And I
the
apologize
we'll
to
open the
have to
panel
leave. I have a patient.
to answer the
Yeah.
question. Thank you.
So that's a very good question. And what I will say is that I advocate for task shifting. And that is exactly what you're advocating for. There are not enough therapists to cope with all of the attachment disorders we are seeing today. And so what I advocate for is peer counseling and task shifting, whether it's voluntary roles from, I started a movement which actually changed, but it was grandmothers, educating grandmothers, training grandmothers sort of like the friendship bench. If you all know the friendship bench, which is training students to sit on a bench and talk to other students about depression. This is mothers to mothers or grandmothers to mothers, where you're training peer counselors to be foot soldiers for the mental health field in communities. It doesn't have to be a professional or a paraprofessional. It can be a peer counselor if they're well trained. So I advocate for task shifting and also community building. So I started an organization called Attachment Circles, which is meant to bring women together and or men, if they're the primary attachment figures, to form communities and play groups within their communities, not to meet virtually, but to meet in person, because what we've lost is community. Many of the women who have the choice to stay home or go to work are choosing to go to work because it's isolation they're facing. They're raising their children without other women who are raising their children, because all of the children are in daycare or are being cared for by nannies or babysitters. So there are no communities of parents to support one another. So thank you for that question, Rebecca.
Thank you, Erica. I don't know if somebody else wants to take up on this question. I see we have Yusra, Professor Kwon, and definitely Francisca and Mariana.
Sorry, Alex, I can just say a little bit, and I
Mm-hmm.
will re-echo what Erica said based on the work that we do. So we work with refugees and immigrants, and we realize that a big thing that they've lost is the community or the support system, which is never, not always formally mapped out for us to see what's there. We've always heard it takes a village to raise a child. Like there's no village anymore, and mothers are isolated and they are alone, and it does take a toll on your health, including mental health. I also our programs are peer-to-peer, mother-to-mother approach is used, and it really works well because a lot of the connection building and breaking the isolation is organic. And we work with women from around the world that are in Canada. And if we pick up the thread of motherhood, it does weave itself across nicely as a common thread. I also want to talk about women going to work, and I love that we've talked about this being a choice with the mothers and seeing, what they being able to choose and not being forced to go to work because there's no care or there's no, money to put food on the table in the house. In our communities, we have seen mothers who would stay at home with their children, but just because of the affordability and the inflation, they are working part-time or seeking to work full-time. So I think we need to be very clear in our position, in our advocacy, that we really want to make sure that people have the choice, and we're not rushing childhood, we're not rushing motherhood, and we're there building that community, sort of bringing back that village. If it cannot be the immediate family, then with the chosen family or with the community or the chosen community. So it's stopped there. Thank you.
Thank you. Anybody from the panel wants to take on this question? Mariana?
Yes. At least in Latin America, there's still a significant stigma surrounding mental health treatment, which has made it difficult to reach caregivers. Therefore, part of our work also involves addressing the challenge. I think this is very important, at least in Latin America. In this context, I like a lot the idea of having peers teaching and support one another, and I think it represents a promising and an effective approach. So I will take note, because in Mexico and in Latin America, it's not so common, this kind of peer-to-peer strategies. So I will take note.
That's the same in Jamaica, because
Yes.
I'm from Jamaica and Caribbean, and mental health is a huge stigma, and it's overcoming that stigma as well. But I'd love Francisca to answer it, because especially community spaces are the ones that you're looking at and designing, are offering for, especially with families with disabilities, where siblings can swing with their sibling in a wheelchair, or someone with cerebral palsy a child with cerebral palsy can go through a trail where the sibling or the parent can carry them through and connect through play with children, with their siblings and children with disabilities. And again, the autism, neurodiversity, are these in taking into account in these spaces that you're creating and researching?
Yeah, thank you for the question. Yeah, so I know some of the projects have looked at that, some of the good practices in some cities and mostly in Europe. I'm forgetting the exact countries, but some of them have taken to how do we, like, should we have pavement or ways like on our roads and our walkways? We should have spaces where people can easily travel without having to struggle. So all those things are part of it. And there are some that are also creating like spaces where communities can come together and learn a skill or engage in an activity that brings them joy, and through that have conversations and be able to talk among each other. And that also helps with like encouraging that sense of belonging and that sense of togetherness as well. So I think it's something that some of the cities have mentioned that they have to work with other sectors. So maybe someone from the health sector understand, okay, what are the needs of the people in our community? So we have people with disability. What are things that we need to take into consideration? And so having that intersectoral collaborations also help in the work in making sure that everyone in the community's needs is being put at the front. And I think those are some of the things that have come up in some of the good practices that I'm looking at and like reviewing as well. Maybe Alex would have more to add.
Thank you, Francisca. Yeah, actually, first, I wanted to offer the floor to Professor Kwon if you want to add something on that question.
Yeah, those
Before.
are really, yeah, excellent question. And then I really like those responses. I think, yeah, I definitely echo what everybody said. And in-person human connections are really, really needed and important. But, it's not always feasible, right? Like rural areas, and there are many, hard to reach like area in the globe. So we need to like think about, more creatively, innovatively, and then provide some more flexible option for them. So maybe like some AI-based coaching, so use some technology, right? So technology can isolate us and also connect us at the same time, like even across countries. So we may probably create some online community or a hybrid like support and learning community. And maybe IFFD can play a role in creating that kind of space online.
Yeah, definitely. Following up on that, actually, the mayors that we address, or the governors, they are developing these good practices, and we have published them. They're on our website, and it's a great way for them to learn from each other, and also us to learn from to try to apply them in our own environments. And I think that's great. We're trying to, or we're thinking of, now that we've been having conversations with some of the private sector representatives, to have also good practices that are coming from the private sector, as we heard that not only from Medica but also from Rebecca, that these are actually places where most of us work. Definitely, we can work from a public sector perspective, but definitely the private sector is present, and we have to hear from it. And I also see another question here from Renata Kaczmarska. She is the focal point on the family for the whole UN system. Renata, I guess that you connected with your image. Please ask away. I think you're muted. I'm sorry. Now.
I just wanted to thank all the speakers, very interesting presentations and viewpoints. Yes, since you represent many regions, I was wondering if you see a major difference in approaches to mental health. I mean, you mentioned a little bit about the stigma that may be higher in Latin America and the Caribbean. But in terms of policy approaches at regional level, do you see differences if in case you work in different regions, or in your particular regions, have you found, let's say, good practices at the regional level that really worked in this area, and maybe some lessons learned maybe from COVID, since we are still struggling with that? I would just love to hear from the speakers about these issues.
Thank you so much, Renata. Who's first? We could start backwards now. I don't know, Professor Kwon, if you want to take the floor, since you've been in many regions lately.
Yeah, maybe I want to do the last.
Okay, sure.
Uh-huh.
I think Yusra is ready.
I can, yeah, for sure. Thanks. It's a great question. I think COVID, as testing as it was, it has taught us a few things that can be done. So we know rural, remote communities, our day-to-day approaches or in-person service delivery doesn't always work because of the smaller scale of the services needed, and it's always good to lean into technology for that. I think there's a little bit of the stigma is, of course, there, not just with mental health, but also with sexual and reproductive health and other health-related issues. But I think it's a bit of the Maslow's hierarchy at work at each family's level, right? So if you're worried about putting food on the table, or if you don't know how to access a food bank, or you don't know the language to, get the services that you need, like mental health, even as a mother, even as a caretaker, it's definitely on the back burner. So certain things need to be in place before people start thinking about mental health, taking it seriously, and actually investing time in seeking the support. So I think we talk a lot about income levels and money and where people are on the socioeconomic ladder, but I think it's worth thinking a little bit about the different types of poverty we're seeing in today's times, especially as mothers and caretakers. So the time poverty is a big thing. Even if you aren't low income and if you aren't poor, people really struggle with time, and that takes a toll on the mental health. I also think, Renata, like there's as governments, as leaders, discuss policies around these important forums that we're part of, we need to see how bad do we want things to be for the children, for the mothers, and for the families, for supports to come in. Like there's really underinvestment and non-recognition of the prevention pieces, which means creating opportunities to strengthen families, connections, and childcare, social opportunities, so that it doesn't get that bad. So everywhere I see, no matter which region I think about, it has to get bad enough for supports and services to kick in and support families and mothers. So I think we really need to be proactive in our day-to-day discussions. And at the end, I feel like no matter where we are, it needs to be a whole of society approach. Like we need to be whole people, whole organizations, and accept that we come with a package deal, right? With our mental health issues and our other health issues and skills. Thanks.
Yeah.
Francisca, you want to take the floor, mentioning
Yeah.
all the regions that you saw, at least Brazil, Mexico, and Europe in general.
Yeah. So I know I wanted to add something about Yusra mentioned earlier about cultural piece as well. So it's something that's very key in terms of addressing mental, even taking Ghana, for instance. I know there are things like people tend to rely on traditional healers or tend to go to other sources rather than going to like a medical source for like mental health issues. So being able to understand the cultural context of the people that you are serving also helps know, how do you address the barrier by building and interacting with the other, like sometimes people listen to like their grandparents or their aunties and their uncles. So having that intervention targets, like maybe brother relationships or networks in their families also is like one of the ways of addressing, like in terms of looking at the regions. And I know in the state of Nebraska, they have this community network where in terms of refugees and immigrants, they have different non-profit organizations that are meeting different needs. So when the parents come, you assess if it's like, like in the house, do you have income? Is it income issues? Is it in terms of access to healthcare? Do you have insurance? What are the things, the barriers that are not making you access the care that you need? So being able to look at all those pieces also helps as well. I think that's the things that comes to mind when this discussion started.
Thank you, Francisca. Mariana? I guess you had something to add. Thank you.
Thank you. Well, in Latin America, due to the limited number of mental health professionals, people often seek support in alternative spaces, such as religious or community-based settings. Mental health services tend to be difficult to access geographically and economically. So there have been efforts to open more mental health centers or clinics in rural areas or marginalized urban zones, but progress has been quite slow. But on a positive note, we have seen more public and political discourse about mental health in the media. So at least this helps raise awareness. And at the same time, initiatives such as training teachers or other key community members to identify and support mental health needs are gradually but slowly being implemented. So we have seen this, but I see that it's very slow, the progress.
Thank you so much, Mariana. I see a question from one of our panelists to the panel, I guess. I don't know, Professor Kwon, if
Before we
you
move
wanna...
on, I probably want to add one more thing.
Sure.
In addition to the potential regional differences I observe in definitely the huge variation by the poverty level and then the state resources and the policy priorities. So I think, that's already discussed. But I also noticed that there is a huge difference by the time, the generation as well. So for example, as you know, the COVID has a huge impact, right? So before, during, and then post-COVID, the mental health is really hit really hard by that, like a global, public health issue. I think that's really, really, important. And also generational variation. And then I noticed that there are more younger generation tend to have more mental health issue than older generations, especially in our teacher sample and then other child and youth samples. So that's what I noticed. I don't know whether this is shared in with other people, other experts.
Anyone who wants to add on that? Because I think, Professor Kwon, you had like a question, perhaps, here in the chat area that...
Yeah, again, I really want to see whether there's any creative way, because I really like that idea of community building and then providing a coaching, kind of not as a formal, but coaching for peer coach or counselor. So I just wonder how we can develop some place online, so for example, including some training online modules and coaching models. So I wonder whether there's any interest or ways to do it.
I can actually answer that. So my nonprofit is Family Civility Institute, and I actually created a 6-module workshop, which I deliver, and I delivered it in Kenya and places in the Caribbean, where I work on anti-oppressive practice to family diversity, supportive counseling, case management. So it's taking social service skills, but addressing the family and bringing that healing to helping dynamic, looking at the family dynamics, the unhealthy family dynamic, and bringing it to healthy family dynamics, and looking at the level, having that support for that level 1 and 2 mental health of caregivers, but as a family unit. And it has worked successfully in Kenya, and where I've taught, because it's quick, it's an easy workshop. It gives them the basic skills to work, as you said, in remote areas. And, it's available, and it has worked, and it's evidence approach work and skills. And it has been effective in that mental health on a family on a whole, because we keep isolating even our family members. We speak about the mothers and the fathers and the children. They are also a family unit together. And when I refer to a child with a disability, I refer to a family with disabilities, because the sibling has to cope in their own way, and they have neglect issues, and not just the child, but we have to look at the family as a whole. And then we have to look at the geographical. I know in Mexico and in the Caribbean and in countries in Africa, we have the issue where we have parents in the UK and the US, and they're working and they're not even living in the same country as their children. And how do we manage that geographical dynamic of a family? So it's not, and I'm glad you brought it up, Renata, because it's not just the rural areas, but families are now separated because the world has globalized, and we've had to look at that as well. And then don't even talk to me about the multi-generational when you have to bring in elder care.
Thank you, Rebecca. Well, I think we ran out of time today, and I love this discussion. I was telling all of the experts when we were preparing this event that it's such a new topic at the UN. Actually, the first time that I had to prepare for this topic was almost a year ago, and actually it turned out to be great because then one of the delegations at the UN asked IFFD to speak on this in a recent event during the Commission on the Status of Women about mental health and parenting and how that influences families. And it was great to open this discussion, to set the stage, to build on this, not only to be included later in the discussions at the UN, but also to have some good guidance or policies that will help us, not only from the highest political levels, but also down to earth, as we have discussed today. That is definitely something that we really want to explore and build on. So as we conclude today's event, let us carry forward to this renewed understanding that supporting parents is not a luxury anymore, but a necessity for healthier societies. And in the Commission on Population and Development, I should say, and stronger populations. What we have heard from our distinguished speakers definitely reinforces a simple yet powerful truth that I'm going to repeat because I already said it in the oral statement minutes ago. When we invest in the mental health of parents, we invest in the well-being of entire generations, as we have seen of the stigma and even cross-national. Let us continue to advocate, innovate, and collaborate across disciplines to build systems, communities, and environments where every caregiver, mother, father, even siblings, kinship, feels seen, supported, and empowered. Thank you once again for joining us and for your shared commitment to families around the world. Thank you so much.